Addressing anti-racism in mental health care is imperative for professionals committed to equitable practice. This episode complements the 2 CE Hours Anti-Racism course by Therapy Trainings. We'll discuss engaging effectively with diverse cultural backgrounds, offering perspectives that can enrich your understanding and approach to inclusive mental health care. In this episode, we will explore several key points from the course, including how to recognize and mitigate implicit biases, the importance of promoting equity and inclusion, understanding the impact of systemic racism on mental health, and the ethical imperative of adopting an anti-racist practice. By the end, you'll have a clearer perspective on these critical issues, along with actionable insights to implement in your clinical practice. Let's start with the foundation of our discussion: cultural sensitivity. In therapy, we're not just treating symptoms, we're engaging with human beings, each with their own unique set of experiences shaped by their cultural background. This course emphasizes the importance of equipping ourselves with the knowledge and skills necessary to respect these diverse backgrounds. But what does that really mean? Cultural sensitivity involves recognizing that each client's worldview is influenced by their race, ethnicity, gender, sexuality, and socioeconomic status. It's about understanding that these factors intersect and can significantly impact their mental health and treatment. For instance, a client from a marginalized community might not only be dealing with mental health issues, but also navigating systemic barriers that make their healing journey more challenging. So how do we foster a culturally sensitive approach? One of the first steps is engaging in critical self-reflection. This means examining our own implicit biases, those unconscious beliefs and stereotypes we hold, often without even realizing it. The course guides you through strategies to help identify these biases and to reflect critically on how they might influence your clinical practice. You might be wondering, why is this so important? Well, research shows that when therapists acknowledge their biases, they can create a more inclusive and supportive environment for their clients. Think about it. If a client feels that their therapist understands their lived experience and respects their cultural background, they are more likely to engage openly in the therapeutic process. This connection can be a powerful catalyst for healing. Now, let's transition to the topic of equity, diversity, and inclusion. Promoting these values within our clinical settings is not just a nice-to-have, it's a necessity. The course emphasizes empowering mental health professionals to actively advocate for marginalized populations. This means ensuring that all clients receive fair and just treatment, regardless of their background. Consider this. In many cases, systemic inequities can lead to disparities in mental health outcomes. For example, studies show that people of color are often underdiagnosed or misdiagnosed when it comes to mental health conditions. By actively working to promote equity, we can strive to level the playing field. This could involve advocating for policies that support equitable access to mental health care, or ensuring that our clinical practices are culturally informed. Let's not forget the importance of effective cross-cultural communication. How do we build trust and rapport with clients from diverse racial and ethnic backgrounds? One of the key takeaways from the course is the idea that communication is not just about words, it's also about understanding nonverbal cues and being attuned to cultural nuances. For example, in some cultures, direct eye contact may be seen as confrontational, while in others it is a sign of respect and attentiveness. Being mindful of these differences can enhance our therapeutic relationships. The course provides practical strategies to improve your cross-cultural communication skills, which can lead to more effective interventions and positive outcomes for clients. Now let's address a common misconception. Some people believe that anti-racism work is solely about individual actions or personal attitudes. While personal reflection and behavior change are crucial, it's equally important to understand the broader systemic and structural factors at play. This course highlights how systemic racism shapes mental health outcomes and the necessity of advocating for systemic change within our field. Let's take a moment to unpack this. Systemic racism refers to the policies and practices entrenched in established institutions that result in the exclusion or promotion of particular racial groups. In mental health care, this can manifest in various ways, such as disparities in access to services, differences in quality of care, or even the types of treatments offered to different populations. As mental health professionals, we have a responsibility to recognize these systemic issues and to advocate for change. This might involve participating in community activism, influencing policy at an organizational level, or even conducting research that highlights disparities in mental health care. By doing so, we can contribute to a more equitable system for everyone. Now, let's shift gears and talk about the ethical imperative of anti-racist practice. This is a core theme that runs throughout the course. Ethical practice in mental health is grounded in principles of social justice, informed consent, and client autonomy. By integrating anti-racism into our practice, we uphold these ethical standards and ensure that our clients receive the respect and dignity they deserve. Imagine a scenario where a therapist is working with a client from a marginalized community. If that therapist is not aware of the systemic barriers that client faces, they may unintentionally perpetuate harm. Instead, by adopting an anti-racist lens, the therapist can engage the client in a way that validates their experiences and empowers them to take an active role in their treatment. So, what can you do to incorporate these principles into your practice? Start by engaging in ongoing education and training, like the course offered by Therapy Trainings. This course not only presents theoretical knowledge, but also provides practical strategies you can implement immediately. In addition, create a space for open dialogue with your colleagues about these issues. Discussing experiences and perspectives can foster a culture of learning and growth. When we share our challenges and successes, we build a community that supports anti-racist practices in mental health care. Before we wrap up, let's reflect on a couple of thought-provoking insights. First, consider the idea that anti-racism is a continual journey rather than a destination. It requires ongoing commitment, self-reflection, and action. Each of us has a role to play in dismantling systemic racism and promoting equity within our field. Second, remember that change starts at the individual level. Each time you engage in self-reflection, challenge your biases, or advocate for a client's needs, you are contributing to a larger movement toward equity and justice. As we conclude this episode, I encourage you to take the next step in your journey. Visit therapytrainings.com to explore the 2 CE Hours Anti-Racism course and other valuable resources. This course is just one of many offerings aimed at equipping mental health professionals with the tools necessary to foster a more inclusive and equitable practice. Thank you for joining me today. I hope you feel inspired to take these insights into your practice and make a meaningful impact in the lives of your clients. Remember, the work of anti-racism is not just a professional obligation. It's a moral imperative. Let's continue to strive for a mental health care system that is truly equitable for all. Until next time, take care.